Hi, my name is Matthew. I'm going to be doing a trachectomy care and suction today. We begin by reviewing the order to make sure that we have a suction order in place, review PPE requirements before entering the room. There are none, so we would knock, enter the room, perform hand hygiene, identify the patient. Good afternoon, Mr. Doe. Name and date of birth checks out. We begin by auscultating the lungs. All right. Here we have crackles, so we need to do some suctioning. Begin by raising the patient's bed. Our equipment is gathered. I'm going to explain the process. Mr. Doe, we're going to be doing care on your trachectomy or tracheotomy. One of those is probably the right pronunciation. We're first going to begin by suctioning, and then we're going to replace the cannula and gauze. If at any point you start feeling pain or respiratory distress, I just want you to either squeeze my hand or lift your hand up. And then we would also assess for pain medication and administer it as needed. Mr. Doe is a tough guy, doesn't need any pain medication. We would get some clean gloves, perform hand hygiene, don gloves. We would set up our suctioning, 150 PSI for adults. Check, suctioning is on, down, and then we would also hook up our oxygen. And then place a chuck down for the patient. That is everything. Remove gloves, perform hand hygiene, and then open up our suctioning kit. Open up away, patient. Toss that. Grab our little sterile cup. Set that down. Open up our sterile saline. We would lift the top off there and then pour out the top to, I can't remember the name of that, but it creates, making sure we're getting sterile saline. Pour, and then place the cap back on. Begin by putting on sterile gloves. Hopefully these gloves fit. Get sterile gloves that fit. That's important. Maintain sterility using the scoop method. And then don't do this, but I have a time requirement to make. We would replace the sterile gloves. They ripped very badly. All right. So we would then take out our suctioning. All right, pause, not the video. We're gonna pretend that we have a sterile glove on our hand. Okay, this is our sterile glove. Wrap up the suction catheter. Begin, this is our non-sterile hand, applying oxygen. There we go. 3 to 6 breaths. And then attach suctioning end there. And then we're going to occlude the suctioning port and will not begin suctioning until we enter the inner cannula. Enter, and then begin suctioning. Only suction for 10 to 15 seconds. All right, move. Also, before you begin suctioning, place the suction catheter inside the sterile saline. But after that, we would apply oxygen again, clean the catheter, and we repeat up to 3 times, leaving 30 seconds to a minute break in between suctioning for the patient. After that, remove suction catheter, turn off suctioning. And then we're going to remove the old inner cannula and the gauze. Rolled up. Toss. We begin oral hygiene. And then we're going to go into changing the trach wrapping and gauze, replacing it, and then the inner cannula. So we get our, we'll toss this, redo hand hygiene, open up our trachectomy care kit, get our new pair of sterile gloves. Hopefully these ones fit. They're not going to fit. So we would put on new sterile gloves. Grab our sterile drape. Place down the patient. grab a cotton swab and place some sterile saline. Then we're going to clean the stoma around the trachectomy, all 4 sides with 4 different cotton swabs. We're going to get our new inner cannula out. Place down and lock. Then, using our still sterile hand, we're going to slide down the new gauze. We take off our sterile gloves and apply new clean gloves, and then replace the trach band. All right, new trach carries in. We'll toss all of our supplies, throw everything away. Lower patient back down to the lowest position. We're in a nice comfortable position. Throw all this away. Give patient a call light, and that is all.